Well, my daughter makes me happy most days.
We'll call this meeting of the Central Nevada Health District to order. Would you all rise and pledge allegiance to the flag? Has the agenda been posted in compliance with NRS?
Yes, Amber Edwards, for the record, verifies that the agenda for this meeting was posted on the 6th day of December 2024 between the hours of 2 p.m. and 5 p.m. at all the locations listed on the agenda.
Thank you. Would the secretary take roll?
Chair Ken Tedford,
Here.
Jim Barbie,
County Manager Barbie, here.
Justin Heath, Bob Erickson,
Here.
Denise Ferguson,
Here.
Don Witten, Larry Rackley,
Here.
Jeb Rowley, Rich McKay, Tina Manzini,
Here.
Brandon Chaddick.
Here.
Thank you.
I think we have a quorum. Okay, we'll proceed to public comment. Public comment should be general in nature, not relative to any item on the agenda today. Discussion can be held, but no decision can be made. Do we have public comment? Hello, Mr. Clifford.
For the record, Bob Clifford from Fallon, Mr. Chairman and board members. Things just kind of keep getting worse and worse on the vaccine front. Tsunami of excess deaths from heart failure and turbo cancers is coming. I mean, excess deaths are already bankrupting the insurance industry, but it's apparently going to get a lot worse, to the tune of maybe 2 billion people worldwide. So destroy the entire health industry, insurance industry, probably destroy the economy. I got in the handout that I provided, there's 5 pages of article links, and the headlines just keep getting worse and worse. And you won't find this in the mainstream media. They're controlled by the pharmaceutical advertising, and they just don't report on it. They probably won't until they can blame it on Trump when he takes office. Then they'll probably start covering it. Large numbers of doctors are calling for a ban on the vaccines and prosecution by Nuremberg-type trials of the people responsible. Government leaders are busily trying to rewrite history to escape blame. Even 2-year-olds are now getting heart attacks, 2-year-olds that were vaccinated. And there's an article that I haven't even read yet that just showed up today that there's a surge in sudden deaths in children that were vaccinated. That's scary as hell. We'll know more. A federal judge has ordered the FDA to release 1 million pages of bombshell documents detailing how COVID vaccines contain eugenic, in other words, cause death chemicals. The NIH has now admitted that the vaccines are behind the global surge in excess deaths. Pharmaceutical whistleblowers confirmed that the vaccines were designed to intentionally harm people. Yet Democrats in Congress are still trying to get a vaccine mandate in place for health workers. I mean, that people are just not informed. To add insult to injury, the life insurance companies are now starting to refuse to pay on life insurance policies, saying that Those who took the vaccine should have known it was experimental, so they're not going to pay. So you think you've got coverage for your family? Maybe not. And they can't pay. If they did, they'd go the whole industry would go bankrupt, within a year. There are products on the market that destroy spike proteins and that can help prevent cancers. One obvious one is something called nattokinase, and made from fermented soy in Japan, that it knocks down the spike proteins, and that helps to keep your body from having myocarditis or heart attack or something. Even low-dose ivermectin can provide protection. I'm in the natural products industry and have a nutritional supplement company, and I'm extremely well-versed in the natural treatments. If you want to get information on that, contact me. You can also just search on Google. Anyway, that's my comment. Thank you very much.
Okay, thank you for your comments. Any other public comments? Being none, we'll go to item 6, consideration and possible action on the minutes of October 10th. You've all had an opportunity to review those minutes. Are there any corrections or additions to those minutes?
Mr. Chair, if I may, Jeff Weed. For the record, it's been brought to my attention that this agenda item, rather than read in October 10th, should read September 12th, as that was the last meeting. However, the chair wishes to proceed, it may be prudent to just put this item on the following agenda for the next meeting for approval at that time, as it was agendized as to the wrong date. But I'll submit that to the chair, but it should be September 12th.
I think we can just make that correction. I don't know that we need to re-agendize it. So I would consider a motion that amends the approval of the minutes of September 12th, 2024.
Mr. Chairman, this is Bob Erickson. I would move that we approve the October 10th minutes with the correction that the preceding meeting was September 12th, 2024.
We have a motion. Do we have a second?
For the record, Larry Rackley, I'll second that motion.
We have a motion, a second. All in favor?
Aye.
Opposed?
Aye.
None opposed, the motion carries. We'll move to item 7. Agenda item 7A is consideration and possible action concerning approval of subaward between the Immunization Office of Child, Family, and Community Wellness and Central Nevada Health District to identify trusted messengers and partners to work with on implementing strategies for vaccination in the amount of $52,360 from 9/1/24 to 6/30/25. Darren?
Mr. Chairman, members of the board, for the record, Darren Winkleman. This is a continuation of a grant that we've had for our immunization program. This is a grant that helps us mostly for public outreach, getting out into the communities, working with our stakeholders, let them know what our vaccination program is, and just a continuation of trying to work with vaccine hesitancy, getting the information out why it's important for kids to be vaccinated. Again, that's just a continuation of that current program that we have.
Okay, are there any questions of Darren?
Yes, Mr. Chairman, Jim Barbie for the record. So this would be existing staff?
Existing staff, correct?
Thank you.
Yes.
Any other questions? Any public comment? Okay, back to the board for discussion and/or motion.
Mr. Chairman, I would move to approve 7A.
We have a motion to approve 7A. Do we have a second?
For the record, this is Denise Ferguson. I second.
We have a motion and a second. All in favor?
Aye.
Aye.
Opposed? Being none, agenda item 7A passes. We'll go to B, consideration and possible action concerning approval of the subaward between the Public Health Preparedness Office of the Bureau of Health Protection and Prevention to demonstrate achievement in the Public Health Emergency Preparedness Program domain according to PHEP cooperative agreement in the amount of $225,001 from 7/1/24 to 6/30/25. Darren.
Mr. Chairman, members of the board, for the record, Darren Winkleman. This is, again, a continuation grant of our public health preparedness program, really trying to look at all of our risk assessments, working with all of the counties to come together as a whole in terms of our emergency response. And so this, again, this was a carryover, a new grant this year, but carryover from the existing program that we had last fiscal year.
Any questions from the board and/or from the public? All right, then I'll entertain a motion.
Mr. Chairman, Larry Rackley for the record. Item B, I make a motion for approval of a subaward between the Public Health Preparedness Office of the Bureau of Health Protection and Prevention to demonstrate achievement in the Public Health Emergency Preparedness Program domain according to PHEP cooperative extension or cooperative agreement in the amount of $225,001, and that's from July 1st of +24 to June 30th of 2025.
We have a motion, do we have a second?
Mr. Chairman, pardon me.
We have a second from Jim, all in favor?
Aye.
Opposed? None opposed, 7B carries. We'll go to item 7C, consideration and possible action concerning approval of subaward between Public Health Preparedness Office of the Bureau of Health Protection and Prevention and Central Nevada Health District to demonstrate achievement in the Public Health Preparedness Program in the amount in the domain according to the PHEP cooperative agreement in the amount of $122,809 from 7/1/24 through 6/30/2025. Darren.
Mr. Chairman, members of the board, for the record, Darren Winkleman. This is a sister grant to the one that was just approved. This grant was the original grant we had when we started out. And obviously, we didn't, with staffing and everything going on, we didn't fully expend that grant. So this is what the state considers a no-cost extension. And so it just helps the grant that we just approved and gives us a little bit more money to help with the public health preparedness efforts within the counties.
Any questions from the public and/or the board for Darren? Being none, I entertain a motion to approve this.
For the record, this is Denise Ferguson. I'll make a motion to approve subaward between the Public Health Preparedness Office of Bureau of Health Protection and Prevention and Central Nevada Health District to demonstrate achievement in the Public Health Emergency Preparedness Program in the domain according to the PHEP cooperative agreement in the amount of $122,809 from July 1st, 2024 through June 30th of 2025.
Do we have a second?
Mr. Chairman, my name is Tina Manzini, Mineral County Commissioner. I'll second the motion.
We have a second. All in favor?
Aye.
Aye.
None opposed?
Aye.
Motion carries, and 7C has been approved. We'll go to item D, consideration and possible action concerning approval of subaward between the Maternal, Child, and Adolescent Health Office of Child, Family, and Community Wellness and Central Nevada Health District to provide evidence-based, medically accurate abstinence education to youth ages 10 to 19 years of age, with priority enrollment given to youth who are disproportionately impacted. The overall goal is to prevent teen pregnancy and exposure to sexually transmitted infections, including HIV, AIDS, in the amount of $62,230 from 10/1/24 to 9/30/25. Darren.
Mr. Chairman, members of the board, for the record, Darren Winkleman. Again, one of the grants that we're continuing on with. This is a program that we had started early on in our infancy, I guess, for lack of a better way. We did a little bit of, most of the education we did in this particular program, specific education was done in Pershing County. We'd like to begin to move that out into the other the other counties this go around. Also during, when we see people within the clinics, we obviously will talk to them about sexual abstinence, but the main focus at this point was in Pershing County, but I'd like to move that forward with this new grant.
Okay, any questions from the public or the board for Darren? I'll entertain a motion.
Mr. Chairman, Jim Barbie for the record. I would move to approve the notice of subaward between the Maternal, Child, and Adolescent Health Office of Child, Family, and Community Wellness and the Central Nevada Health District to provide evidence-based, medically accurate abstinence education to youth ages 10 to 19 years of age, with priority enrollment given to youth who are disproportionately impacted. The overall goal, that's the end.
We have a motion to approve 7D.
Mr. Chairman, Tina Manzini for the record, Mineral County Commissioner. I'll second the motion.
We have a second. All in favor?
Aye.
None opposed? Motion carries to approve 7D. We'll go to item E, consideration and possible action to approval of a subaward between Chronic Disease Prevention and Health Promotion Office of Child, Family, and Community Wellness and Central Nevada Health District to develop and implement services in Eureka, Churchill, Mineral, and Pershing counties as part of the new Central Nevada Health District to build a healthier rural Nevada in the amount of $45,000 from 10/1/24 through 9/30/25. Darren.
Mr. Chairman, members of the board, for the record, Darren Winkleman. This is a grant, again, a continuation from the grant we had previous. I'm pleased to announce this is a little bit more money, not a lot, but a little bit more money in this particular program. Looking at chronic disease, we want to focus, working with our EPI program to look at the kind of the highest 3 risk factors within the counties, within the district, and then kind of focus our educational materials on that effort. And so this, again, just a continuation of what we've been doing the last year.
Okay, is there any comment from the public and or the board on 7E? If not, I would entertain a motion to approve 7E.
To approve the subaward between Chronic Disease Prevention and Health Promotion Office of Child, Family, and Community Wellness in Central Nevada Health District to develop and implement services in Eureka, Churchill, Mineral, and Pershing counties as part of the new Central Nevada Health District to build a healthier rural Nevada, the amount of $45,000 from 10/1/24 through 9/30/25.
Jim Barbie was second.
We have a motion and a second. All in favor?
Aye.
None opposed? Motion carries. We'll move to item 7F, consideration and possible action concerning approval of grant 2024 AAA Child Passenger Safety Donation Program and Central Nevada Health District to be distributed in accordance with program terms for the 2024 AAA Child Passenger Safety Donation Program for the amount of $2,000. The financial grant must be used in 2024-25 for the purchase of car seats and/or for car seat checkup events. Darren.
Mr. Chairman, members of the board, for the record, Darren Winkleman. This is a new grant. I have to say off the bat, I'm really proud of Carol Flick, who is one of our resource liaisons, community health workers, and she found this grant, went after it, and was able to obtain a little bit of money, $2,000. Like I said, it all helps in everything we're doing. In this particular case, it's designed to buy car seats, and then those car seats can be given to people that are a little Medicaid eligible, lower income bracket families. Carol, along with Nicole in our Hawthorne office, are certified as passenger safety techs. And so they're able to not only give the car seats to people, but also able to install them and help people understand how to install them correctly. And so hopefully we'll be doing some of those events as well. So we're pleased about this one of those kind of a fun, good grant that will help us move that program a little bit forward. So.
Okay, any questions of the public and/or the board? It's good they're able to, they've been trained or whatever you just said in public safety. You know, your staff.
I'm sorry, say that again?
It's good you said they're trained in public safety and the installation of these. There's a certain liability that goes along with how you can't just put them in. Someone has to be trained. I know
Yeah, so they're trained, they have all the,
people bring them to the police department because we've sent guys that are trained to put car seats in. And it takes away their liability or whatever of
yeah, they've,
puts it on the city, I guess, is what it does, because our police guys do it. I see
Yeah.
them all the time on Carson Street putting in car seats, and only the guys that are trained can put them in. So I'm glad your people are trained in putting them in.
yeah, for the record, Darren Winkleman, yeah, they've been to a training and a class up in Reno, I'm thinking that's true. And so and then they could keep up on those certifications as they move forward, too.
I
We're
mean,
proud to have them on that, on,
all of us up here grew up without car seats, but
my
we all
mom's
had,
car seat.
we all had kids that had car seats, and we just put them in every which way. You know, and they came flying forward when you stopped, so.
Yeah.
But at least they were in a car seat rolling around in your car, but, okay, thank you, that was my only comment. I'd entertain a motion to approve this grant.
For the record, Larry Rackley, I'll make a motion for approval of grant 2024 AAA Child Passenger Safety Program donation program in the Central Nevada Health District to be distributed in accordance with the program terms for the 2024 AAA Child Passenger Safety Donation Program for the amount of $2,000. The financial grant must be used in 2024 and 2025 for the purchase of car seats and/or for car seat checkup events.
We have a motion, we have a second.
Second.
We have a second, all in favor?
Aye.
Aye.
None opposed? Motion carries, and we'll move to 7G. Consideration and possible action concerning approval of a subaward between Epidemiology Office of the State of and the Central Nevada Health District to participate in communicable disease surveillance activities for Churchill County in the amount of $16,950 from 8/1/24 through 7/31/25. Darren.
Mr. Chairman, members of the board, for the record, Darren Winkleman, this is a new grant for us. This grant was provided to help us really bolster our EPI program. It is a little bit specific in terms of some vector stuff, work that we need to do, but also just looking at communicable disease as a whole. And as the state begins to look at more kind of consolidating EPI programs, bringing people together, this grant will help us to attend those assessment meetings and surveys that they have, and just report on that communicable disease activity that we have within the district.
Okay, are there any questions from the board or from the public? If not, I'll entertain a motion on 7G.
Mr. Chairman, Jim Barbie for the record. I move to approve notice of subaward between the Epidemiology Office of the State of Nevada and Central Nevada Health District to participate in the communicable disease surveillance activities for Churchill County in the amount of $16,950 from August 1st, 2024 through July 31st, 2025.
Mr. Chairman, Bob Erickson, I second.
We have a motion and a second. All in favor?
Aye.
Aye.
None opposed. 7G has been approved. We'll go to 7H. Consideration and possible action concerning approval of a subaward between the Public Health Preparedness Office of the Bureau of Health Protection and Prevention and Central Nevada Health District for a no-cost extension to support the feasibility of establishing a health district and improve data collection and reporting of COVID-19 testing and results in the amount of $415,685 from 7/1/23 through 6/30/25. Darren.
Mr. Chairman, members of the board, for the record, Darren Winkleman, this is a grant that we had originally, if you recall, that we started. It was $1.3 million. That grant was not renewed this go-around. We had to push a little bit harder, but we were able to get this no-cost extension on that grant for this next fiscal year. As we move into FY '26, this particular grant will no longer be renewed. And so we'll have to, dig deep into our pockets, we'll sharpen our pencils, but this is at least to get us through FY '25, and basically the effort to continue the district moving forward, to continue the effort that we're doing, and that's what this money here is designed to do, so, yeah.
Any questions from the board or the public? If not, I'll entertain a motion to approve 7H.
Mr. Chairman, Bob Erickson for the record. I move to approve the notice of a subgrant between Public Health Preparedness Office and the Bureau of Health Protection and Prevention and the Central Nevada Health District for a no-cost extension to support the feasibility of establishing a health district and improve data collection and reporting of COVID-19 testing and the results in the amount of $415,685 from 7/1/23 through 6/30/25.
Do we have a second?
For the record, Denise Ferguson, I second.
We have a motion and a second on 7H. All in favor?
Aye.
Aye.
None opposed? Motion carries. 7H has been approved. Item 8 is for public comment, general in nature, not relative to anything on the agenda tonight or today. Is there any public comment? Being no public comment, we'll go to item 9, board and staff reports. Ted?
Mr. Chairman, Board, I have provided you an executive summary. I will give just a few quick highlights, and I'll be open for questions. And these comments address things or more that's happened in the last week since this has been provided. The Nevada Agricultural Department reported that there was cases of avian flu H5N1 in Nye County, and that's being reviewed. No human cases are noted. At this point, with pasteurization and the processes, there's no belief that milk can pass this on. The only product that could probably cause it if you used raw milk, and the use of raw milk is illegal in the state of Nevada. This coming Monday, have a county health officers meeting. On that date, we'll be receiving information from Misty Vaughn Allen, who is the Suicide Prevention Coordinator for the Office of Suicide Prevention in the Division of Public and Behavioral Health. This may be the answer to the thing that we're curious about, why our reports about suicidal ideation, suicidal attempts are so different between the counties. After contacting as many people as I could and finally coming to this person, what we will be hearing is their plan to revamp the whole program. We're not the only ones that are curious about where the information's coming from. Too many sites are being reported. Churchill County has 4 reporters within our county. Every other county only has 1 reporter of this process. They've noticed that things are awry and that they need to regroup and represent it. So I'm hoping that at our next meeting, I'll be able to give you an outline of what their plans are. Finally, we did have the Banner Clinics had a review by Residency Program Solutions, which is in the continuing process of determining if we can get a residency program within Churchill County that would benefit all the counties in our health district and surrounding counties. What we've heard, the next step we've got is we are receiving education on how to apply for the programs and fill out the paperwork. So we haven't seen the written report from this, the counsel or consultant, but that is coming to us. Justin Heath has reserved a spot for this group to talk to the county commissioners on January 15th. I'm also going to talk with, well, I'll be asking you folks if you want to hear a report on this program, and also with Mayor Tedford's office to see if the city council wishes to hear. I occasionally report this. This has been a long process. Probably a year and a half ago, when we were still Churchill County Health Board, county commissioners that were on the board asked me about why we don't have a residency program. The comments that brought this up is in our deliberations of community needs, physician need came up as a priority. And they asked me about having residency programs. It has been started in the past, it has not been finished, and myself and the Banner CEO, CMO, and the president of the University of Nevada School of Medicine, and now members of the residency program, and Gerald Ackerman, who is with the Rural Medical Education Program, have come to a point where we believe we have there's the light at the end of the tunnel, and it's not a train. But it's still not a short process, but it's hopeful. And
Well, I think that's good news. If your 2 words, hopeful.
Pardon?
I think it's good news if your 2 words, hopeful.
Yes. The state of Nevada, or through the Rural Medical Education Department, and for federal grants that are pushing through to the state, there's an opportunity to have a $750,000 grant over 3 years to help establish the program. I'm thinking what the committee or the group would be asking the entities is initially for support in letters of support in grant writing.
Okay. Darren.
Mr. Chairman, members of the board, just real quickly, a couple updates. I had shared Senate Bill 43 with the chairman. Senate Bill 43 is an interesting bill this year. Certainly will affect our district. I am going to be meeting with state representatives from the Nevada Division of Environmental Protection via Teams meeting next week to kind of listen to their intent of the bill. So we'll have more to report on that as we move forward. And certainly after that meeting, I will forward you all of that bill. Hopefully by then I'll have a little better understanding of kind of what they're up to. So just wanted to give you kind of a heads up with that one. I also met with Dr. Kingsley today regarding that bill and some other, Dr. Kingsley from Northern Nevada Public Health, their health officer, about that bill, and just really about more of a collaborative effort between us and Northern Nevada Public Health, and certainly in the north. Obviously, he understands that Southern Nevada has kind of their own little island, their own little state down there, and so we want to kind of work more collaboratively with the northern folks. So trying to work with the state association, city, county health officials, get that really up and going and be a part of that. Next board meeting we would like to do, we'll do a mid-year update on our budget, where we're at. Hopefully look at a little bit of what FY26 may look like. County Manager Barbie may, correct me if I'm wrong, but I believe we're going to have some instructions coming out probably early the first of the year on our budgets. And we'll begin to build that FY26. So more information to come on that. And I think, also met Lander County's health officer, Dr. Ross, reached out to us, Dr. McDonald, myself, and we met with him. He's interested in looking at doing an interlocal agreement with Central Nevada Health District and doing the food service environmental health, just looking at food service right now. He really wants to break away from the state, and so I just wanted to give the board an update. We're there, we're working with him to see what that's going to look like, what that interlocal may look like, and then ultimately kind of what funding is available moving forward with that. So I think that's, in all honesty, good news for us. They see that the district's moving forward and the benefit of having local representatives to talk to and be able to reach very quickly. So more to come on that as we move forward. So those are kind of my updates.
Mr. Chairman, if I may. For the record, Jim Barbie, is there any kind of preliminary model of what that would look like? I'm just thinking of the distance and component, if we were to do the food component, health component of that. I mean, would that be a part-time employee that would be there, or what's your initial thoughts? Just curious. And if it's too early, feel free to tell me it's too early, Jim.
Yeah, in all honesty, Mr. Chairman, members of the board, for the record, Darren Winkleman, in all honesty, it is a little early. We talked to Dr. Ross a few months ago about this and just kind of went silent, and then he picked up on this a couple of weeks ago. And so we're anxious to see what kind of funding is available. He did not give us that number yesterday in talking with him, but there's certainly going to be some, as you know, it's easy when we travel to Eureka, we're going right through Austin, but when you start thinking about traveling to Battle Mountain and the services there, there's going to be a little bit of a lift there, and so we want to understand what that's going to look like. And I have to sit down with Maria and see what she thinks about, can we do it with existing staff? Is it going to look like hiring somebody else or contracting some? I don't know, all those kind of things will start to percolate up, but long story short, not quite sure yet with that till we dive into a little bit deeper.
That revenue stream is going to have to be significant for me to think we're going there. I mean, we got 4 counties and a city that we have to worry about that budget,
Yeah,
let alone branching somewhere else, unless that revenue stream's pretty high.
yeah, I don't know what they provide to the state at this point. I just don't have that, kind of what that subsidy looks like, but more to come. Just wanted to make sure the board was aware that we've been, at least those conversations were started.
I mean, there's probably 14 rural counties that want to leave the state. But, maybe they should be in some other, some other group than Central Nevada Health.
Yeah,
Just thought you need to think about that. We've got to take care of our core before we start. And it working really well financially. Branching out unless there's some big revenue stream coming into us that would help fund our core. Okay,
Just a quick.
Denise.
Hi, for the record, Denise Ferguson. Darren, since we did a lot of grant approval again, and some of them extensions, and since we've been a good year and a half into this process now, have you been really writing the grants? Who's been writing the grants? And is there thought of getting a contract person to help you with more grants, since that one that had a significant funding opportunity in '26 is going to go away? That doesn't surprise me. We're seeing that in all the healthcare arenas. We're not getting any more of that money that was related to that event. So kind of what's your plan, or is that going to be built into your fiscal '26 kind of discussion?
Mr. Chairman, members of the board, for the record, Darren Winkleman, we have not been involved. We've written a couple grants. We've been unsuccessful at those grants. The drawback we're seeing with a lot of the grants that we're looking at right now are they create new programs. And we don't really think we're in a position really to take on some of that work and additional staff to do that. We haven't really been successful in looking or finding grants that are infrastructure specific and help us keep moving with what we've got. To be honest, we utilize everybody in the district to look for grants. We are on the federal grant websites. We get notifications from the governor's office. I think they come out weekly on their grants, and we try to look and find what's out there. But right now it's just relying on what the state, all these pass-through dollars that the state can provide us at this point.
Have you ever been in contact with Nevada Lab Grant?
Have not.
Just as a recommendation, I would reach out to them. They're a grant-sponsored, only Nevada grant association. They're sponsored to support Nevada to receive more grants, not only locally, but from the federal government. And their office actually helps you specifically find grants that are specific to your needs, and they actually have grant money to help write the grants for you. So it would be a really good opportunity if you haven't engaged with them. They're in Vegas.
Great,
But they
thank-
can do Zoom and that kind of thing. I've used them for my own purposes, so they would be beneficial for you guys.
Great, thank you. Yeah, we'll reach out for sure, definitely.
Okay, any other board or staff comments? Being none, I'll see some of you, but others I will not, so I'll wish all of you a Merry Christmas and have a great time with your families and be safe. With that, we stand adjourned.